guys, welcome back to my channel. My name is Dr. Ria and this video is going to be about DNB Radiology, which has been on many minds since the NEET PG result has been announced. So I thought who better to tell you than my seniors from Sir Ganga Ram Hospital. So I have with me Dr. Varun. Can you please introduce yourself?
Hi, I'm Dr. Varun. I am a second year radiology resident at Sir Ganga Ram Hospital. I have done my undergraduation from Kasturba Medical College, Mangalore.
Yeah. And Dr. Mayank.
So, hi everyone, I am Dr. Mayank Goyal and I am just doing my DM in cardiovascular and interventional radiology from AIMS, and I am first year resident, and I have just completed my PG from Sir Ganga Ram Hospital last year only. So thank you so much, Ria, for inviting us.
Yeah, thank you so much.
Yeah, it's been an honor for us to be here and part of your channel. So thank you.
Thank you so much, sir, for being here, because I have gotten so many queries from so many students asking me that should they opt for DNB Radiology or not. And to be honest, even I wasn't sure what to tell them because I've only been in this for like a year. So let's first start out by asking both of you, because I had a rank of 369 in my NEET PG. Dr. Varun sir had a rank of 353, and I think you also had a really good rank of 700.
786
right.
I got.
So you guys could both have gotten MD Radiology in a pretty good hospital. So let's start with Dr. Varun. Why did you take DNB Radiology at such a good rank?
Yeah, so I had given my NEET PG in the year 2022 and I had a rank of 353. I had like two main reasons to choose a DNB at Ganga Ram. First off, I knew that I wanted to take radiology itself and not any other branch. And at my rank, I wasn't very sure if I would get the top Delhi or Mumbai colleges. Apart from that, I am from Mangalore. So in Mangalore, all the colleges are private and they have a pretty higher fees.
Right.
So I knew that I had to move out of the city. So then when I was looking at other colleges, I realized many of the state colleges have a bond. And I already have a 1-year bond from my undergraduation.
Okay.
So I wasn't very sure if I need to take another college, which I would have to, have a bond, because there's a lot of uncertainty about bonds in different
That's
states.
true.
So because of that, I shortlisted the colleges to the places which did not have bond, and mostly it is Delhi, Chandigarh. So
right.
in my priority list, so that was one of the things I considered. So not having a bond, good institute with overall exposure in different fields, and of course something that I could get at my rank. So when I looked at such colleges, I shortlisted to just 2 or 3 colleges that I could get, and I felt Ganga Ram offered really good exposure in terms of diagnostic radiology, so I ended up choosing Ganga Ram.
So even though you belong from South India, I think it's not very common from someone from a completely different state to come and do DNB in a different part of the country. Like I prefer DNB because it was more close to my home, even though it was in Delhi, but it was closer to my home.
Right.
But sir came from Mangalore to Delhi, so he, I think, made a pretty smart choice, because he prioritized not just the location of the hospital but also the infrastructure, the bond. And these are very, very important things. I think people overlook the fact, they only see the tag of DNB, but what is more important in our branch is the infrastructure, the modalities, and the bond is also very important. So sir, I think 2-3 years back also, I think the DNB stigma would have been more than now. So why did you take up DNB?
Yeah. So the reason being taking a DNB over MD. So at my rank at 786, I was also getting MD, and choosing DNB over MD. So at that time there was a lot of stigma and lot of discrimination was there, and the people had a thought like we DNB people are inferior to MDs and just like that. But choosing DNB over MD, the main reason was like there is no bond. And in DNBs there are very good hospitals, and that is basically being on the search only. So first you have to search for some good institutes of DNBs where you can get access to all the modalities, all the latest technologies and these things which are the priority in the field of radiology. So we are just going through a phase of radiodiagnosis. So for the radiology, the modalities are more important than the patients, and patient are also more important, but those institutes you should search for in which all the modalities are there and all the caseloads and workload will be there, so that you can get access to all the spectrum of cases. So and third reason was like ki, you being in a good city like Delhi, Mumbai, Bangalore, so you will get access to all the conferences, all the latest updates, and new things are happening in the cities, and new some CMEs are happening. So you will get access to all those things. So for being a PG student, you should look for those things which will give you some chance to gain all the knowledge of the subject. So for a radiology, DNB is preferred nowadays.
Like
but
a well-rounded exposure.
Yeah, for a well-rounded exposure.
So sir, like sir has finished his post-graduation from Ganga Ram. He is now doing his super speciality. So sir, by the end of your 3 years at Ganga Ram, did you feel confident as a radiologist that you would have felt maybe at a peripheral government college?
Yeah. So I just want to tell about like not only Ganga Ram. There's some of the great institutes in Delhi apart from Ganga Ram, like if I just want to take some names like Max Saket, Apollo Hospital is good, and there are other Batra is good. Yeah, so there are some of the good hospitals in Delhi also. So being in Ganga Ram, so first the pros of Ganga Ram is that you will get access to all the modalities, like fluoroscopy is there, like CT, MR, and intervention postings are also there, and ultrasound, antenatal, so whole spectrum of radiology is there. And in only the first year itself, you will get posted to all the things, like CT posting is there, MRI posting is there. So like in other peripheral government colleges, you will get access to CT and MR in the final years.
And many don't even have the facility.
Functional CT MRIs are not there in some of the peripheral government institutes, and even in the good government institutes, these facilities are not there. So second thing, like all the CT cases, like angios, peripheral angios, like even all the complex surgeries are happening in Ganga Ram. So there are access to all the different kind of CT procedures, MRI procedures. So these things are not there in the peripheral institutes. So choosing Ganga Ram give you edge over other institutes.
I would also like to add that whatever surgeries happen, there is a feedback to us as to what came out finally in the surgery and what is the histopath diagnosis. So we know whatever we have reported and whatever has come finally.
So that's sort of a good thing Varun has included. So yeah, for a radiologist, you are becoming a clinical radiologist. So whatever diagnosis you are giving, you should know what exactly it comes out. So we in Ganga Ram, we have access to histopathological reports also, and we have maintained some IF register, so we can look those interesting cases also. So that give you a chance to look all the spectrum, all the good cases that used to come in day-to-day practices, and you will become confident after that.
And I think not only Ganga Ram, sir, most of the good private institutes have a PAC system where you can access the old cases and you can retrieve the images of the really good cases. So you can have a retrospective learning also. So that is one more advantage of private hospitals. I don't think government hospitals have a very strong PAC system.
And one added advantage of Ganga Ram is we could get both private and government patients. So we have like a good mixture of both. So
and being in a private practice after finishing your PGs, so I think the quality matters a lot nowadays, not the quantity. I think and the consultants are very good. They are very experienced consultants. So you will learn from them, and you will see their reports and how they are reporting and how good they are at their diagnosis part. So, and all the subspecialties are being running in that same institute, like MSK part is also being done by some good MSK radiologists, cardiac radiology and GI radiology. So these things will give you a chance to learn lot of things.
Right. So Varun sir, like for you it's been 2 years at Ganga Ram. Do you feel like you have done what, like, you know, how much you should have learned at the end of 2 years? Even though it's a DNB institute, do you think that has held you back from learning, or it has been good?
Again, as I said, that Ganga Ram has really good exposure because they have both government and private patients coming in. So I think, except for the interventional radiology part, the diagnostic radiology part, I feel I've learned adequately. I mean, radiology is very vast and it's a
Right.
lifelong learning thing.
Right.
But I'm pretty much satisfied with taking Ganga
Yeah, like
Ram.
I see Varun sir and I think he is doing like pretty great. I wish that I can learn as much as sir has learned.
Both
by
of
that.
my juniors are doing very good.
Actually, none of us have done as good as Mayank sir has
No,
done.
no,
I
So,
swear.
Mayank sir has gotten a rank of 9 in INICET Superspeciality
Yeah.
and now he is doing DM in AIMS Delhi. So, sir, before we start upon your AIMS journey, so immediately after you passed out from Ganga Ram, you would have been looking for jobs outside in
Yeah.
Delhi. So, did you face any bias while getting jobs because you were a DNB graduate and not an MD graduate?
No. There are two things which you will look after completing your PG. First, you will do any SRship in government institute,
Right.
or you will join some private
Private
center or like that.
Mhm.
So, doing SRship in Delhi or other government institutes, so there is a interview for that, and they will look ki how many publications you have done, how many poster presentations you have done, and how good at your knowledge, and they will ask some questions. So based on that, they will take you. They will not judge like you are a DNB or a MD. So the good thing about doing DNB, you know, and you have done lot of publication, and you have done work, you have worked hard in your institute, so you will get access to it, and there is no discrimination about these things.
So neither in
nowadays.
private centers nor in a government
Yeah.
institutes.
Yeah, and in private centers, they hardly ask you what's your degree. So yeah, they will take based on your work, how much good at your work and how fast you are. So based on that thing, they will take you, not just because of your.
So, sir, as you
Yeah.
are working in AIMS now, like you see new SRs coming in, like regularly, like, and you have seen the SRs in the past. So, are there equal number of post DNB SRs and post MD SRs? Do you see like?
Yeah. So nowadays, 3-4 years back, or maybe if we consider the previous time, so yeah, there must be some the percentage of taking DNBs and over MDs. Mainly in the these institutes, the ratio was less, but now it is being equalized, and there's a in AIMS or PGI there is a separate theory exam, and after that they have a separate viva. So this is basically
For entrance into SRship.
yeah,
Okay.
in entrance into the SRship. So
Okay.
that is not a biased thing basically.
Okay.
So
Many students are very scared of the DNB exam because it has been known that the passing rates are very low for DNB. So is that really true? Is that something you should actually be afraid of?
okay, so coming to that part, so yeah, previously it was very low, passing percentages were very low, like 6-7 years back, like people were afraid of taking DNB just because of that.
Yes.
But nowadays it has improved. So at my center on my Viva day, the practical Viva day, so all of 7 which came to give the Viva, all of them passed. So it basically depends on how much you work hard and how much you give value to your postings, and how much you learn in the 3 years. That really matters. So the passing percentage in last few years, in I'm telling about the radiology only, so it is basically 85 to 90%,
It's
and that
pretty
is
good.
pretty good enough
Yeah.
actually. So considering the part of radiology tenure, so yeah, DNB give you much more edge to learn the theoretical part also and practical part also. So if you read more, you will learn more, and eventually you will pass. It's not a big deal actually nowadays.
So the myth about passing or failing the DNB exam, it's not about DNB, it's about you. It's
Yeah.
about how hard you want to
Yeah,
work, and
yeah.
if you are going to be consistent in throughout your 3 years of residency, then I'm sure you have you ever seen anybody deserving who has failed?
No.
Right? No one deserving is going to
Yeah.
fail. I think it depends on how hard you work and.
And the basic thing that people used to afraid about, like the exams, the practical exams are happening in DNB outside your state or in the different state. So that is the main thing which people are usually afraid of. But yeah, considering that part, if you are good enough at your knowledge, so you will pass any exam, and that thing doesn't even bother you not to choosing DNB over MD.
So, Mayank sir, did your 3 years of residency at Ganga Ram help you crack INICET SS, or like the hard work you had put in to clear your DNB final exam, did that help you get a good rank in INICET?
Yeah, definitely yes. So I have not put any extra effort for INICET. Whatever I have read in these 3 years, I have just went through it, and it was very easy to crack these exams. And even if you want to crack any of the exams, like any of the foreign exams, FRCR, or any fellowship exam, you just want to, so there is no discrimination over MD over DNB, and DNB people are cracking these exams much better than MD people, because they have access to all the things, they have seen lot of cases, and they have that visual memory. So yeah, it's basically a image based subject, so it's quite easy for them to crack these exams, and yeah, it really helped me.
I won't say that it's easy for everybody. I think Mayank sir has especially worked very hard. Like Varun sir has told me that Mayank sir used to stay back, especially late, even after his regular postings, to stay back and see more cases. So I think his hard work definitely paid off. But yes.
No. Actually, I think if you are choosing radiology, and you just people has perception like radiology is a very chill branch, and we should take this just because it is a 9 to 4 job, and you will enjoy after that. But yeah, I think so these days, mainly you should become a clinical radiologist, and I think you should put your efforts efficiently, and you should work in the department, and you should learn lot of things, because radiology is just like medicine or just like surgery. If you are interested in this branch now, you will gain lot of things, and you will enjoy this branch. It's not like a black and white thing, or like many people used to say it's a black and white thing and it's quite boring. No. I am just learning radiology for the last 4 years or like this thing, but it's never get bored, and I really enjoy radiology, and it will give me lot of new things, and yeah, so
thank you.
I
So
really
Mayank
love
sir
it.
is not only giving you insight about DNB, but also about radiology as a branch. It's making me feel excited about my future in radiology.
Yeah.
So before I end this chit chat, Dr. Varun, like many people are asking about radiology at Ganga Ram specifically. How is it, what are the working hours? How much is the hands-on? How much is the stipend? Can you just give a quick rundown of that?
Okay. So I'll tell it department wise. So we get rotations in mainly 5 departments, that is X-ray and fluoroscopy, ultrasound, CT, MRI and fetal medicine. Apart from this, we have outpostings. I'll discuss about it in detail. So in X-ray, it's mostly 9 to 5 and
9 to 6.
9 to 6 and we get to report X-rays as well as do and observe fluoroscopic procedures, various fluoroscopic procedures under the guidance of a HOD. After that, we have ultrasound, which is 9 to 6:30. So we get a good number of government patients as well, which the residents do. Our scans get checked by the consultants, so you're not missing out on anything.
Yeah.
We also get to do portable ultrasounds after second year, and the ultrasound postings per se is non-vascular and non-obstetric ultrasound. So the vascular ultrasound is done by the vascular department, which is one of the drawbacks I can say. So the peripheral limb Doppler and carotid Dopplers are not done by us. We do renal Doppler, liver Doppler, transplant Dopplers, so that is under us. For vascular, we have a posting in our final year, but that usually overlaps with our exams.
Right.
So, but yeah, if we do
But
show
Dr.
interest,
Mayank sir has told us that it's not very difficult to overcome these shortcomings
Yeah.
after your post-graduation
Yeah,
as well.
because
Definitely.
every institute will have its own pros and cons.
No
so I
place is
think
going to be perfect. Right?
perfect, yeah.
Right.
And in fact, sir is doing vascular, cardiovascular interventions now. That is.
I'm just doing cardiovascular radiology, so lot of peripheral Dopplers and these things I'm doing right now.
Yeah.
And I think this is not a tough job actually. if we are doing some hard part of Doppler like renal Dopplers, liver transplant and these
Which
things.
we get to do at Ganga Ram.
Yeah, which we used to get at Ganga Ram. So I think peripheral, some things are every institute has some has some cons. So that I think this is not a big thing.
Exactly.
Like we can't learn after that. So.
Then we have 3 months of postings in fetal medicine, 1 month in every year. So we learn all the level 2 scans, the NTNB scans, the BPS, Dopplers, etc. Then we have CT postings where we report all sorts of NCCTs, CCTs, angios. And then we have MRI, and MRI is one of the best postings in Ganga Ram because we get exposure since first year and we are allowed to choose whatever we want, whatever scans we want, and then get it checked by the consultants.
Right.
We have outpostings in our final year in mammography where they do breast ultrasound and breast tomosynthesis, etc. Then we have nuclear medicine and PET CT postings for 1 month. We have interventional radiology postings. So IR is also one of the less, what do we say, less hands-on postings in
Right.
Ganga Ram compared to a government institutes because IR is a separate department and they have their residents, fellows and consultants who do that. We have a month and a half in our final year, but again it really depends on
how interested you are.
Interested you
Because
are
most of us are usually busy preparing for our exams.
for
and
our
that
exams
kind
in
of-
our third year.
Right.
So again that's
And
that.
the good thing about Ganga Ram is that like if you show more interest towards something, so people are willing to teach you. And consultants are very helpful in Ganga Ram. So yeah.
I think so, not only in Ganga Ram, like in many
Yeah.
private institutes, in your DNB program, how much you learn is going to be directly proportional to how enthusiastic you are to learn.
Yeah.
And your consultants will be willing to give you more hands-on if you are more interested and willing to work hard.
So apart from the postings, we also have classes and interdepartmental meets. Classes happen every Wednesdays and Fridays, and then we have interdepartmental meets, that is X-ray meet, CT meet, MR meet, that happen once a month on Thursdays. Apart from this, there are night duties and holiday duties as well. There are, I think, as a first year, you will get around 7 to 8 nights a month, and once you go to the senior pool, you will have anywhere from 4 to 5, and it even gets lesser. So that's about the night duties.
And there are no post-night duty offs. Like you
Yeah.
have to come back to the department and work all day.
That's as of now, yeah.
But that is a disadvantage because you get a bit tired.
You get-
But I think 7 to 8 night duties in a month, in a first year, I think that's reasonable because you get like a few days in between to recover from your night duty.
Yeah, and you always have a senior with you. So
You always have a senior with you, it's never just you on call, so there's no pressure on you as such. So it's more about learning than having to actually work.
Yeah. Ganga Ram also encourages you to write articles and present in various conferences. So that is another plus point. Then we have a stipend of 92,000 and after deduction we get around 86 as of now. And for accommodation, many of them have been asking regarding the accommodation. So there are hostels provided by Ganga Ram. So, but it's usually full and people would prefer to stay outside, and Old Rajendra Nagar is pretty expensive that way, but I think one has to find their own accommodation around.
Right.
That is another
So
thing.
some cons of I would say that the area around Ganga Ram is a bit expensive, so you might have to pay more of your salary on your rent and your electricity and your daily food. So that is one con of the area, but other than that, I think the location of Ganga Ram is pretty good. It's very near to CP, so you always have a place to go within like 10
Yeah.
minutes. It's very close to India Gate, so you have nice places to enjoy. And of course, every department is going to have some things lacking or the other. As Sir has told, we don't have so much exposure to IR and vascular Dopplers, but these are all things which you can make up for in your fellowship or your DM if you are very interested.
Yeah.
But I think it is sufficient to make you into a wholesome radiologist as such.
Yeah.
Right, so talking about Ganga Ram, because there are only 3 primary seats for people who might not get Ganga Ram or people who are not from Delhi. Like, do you know any other very good DNB institutes which also offer a good radiology program? Like,
Okay, so in Delhi, which I know, like Max Saket and St. Stephen's, Apollo Hospital Delhi, Batra Hospital, BL
Holy
Kapoor,
Family.
and Holy Family, and in Gurgaon also like Medanta and Artemis also. So yeah, So that you have to figure it out, and you need to ask the residents also ki how much work you are getting, and so for my knowledge, I have known these many institutes.
And I've heard of many good institutes in Mumbai also. So it's always better to inquire at the hospital rather than trying to find this information online, because things might be very different in person. So be sure to do that. But the point of this video was to try to break the myth about DNB radiology. Many people are very scared of taking DNB. So to definitely don't run away from the DNB tag. I think if you are very interested in radiology as a branch, and if you are able to get a good institute where you get hands-on in a good number of modalities, like CT and MRI, then you should definitely give it a good thought and not be scared of the degree or the exam per se. If you are interested and you work hard, I think you will do very well in that branch, no matter what. So I would like to thank you so much, Varun and Mayank sir, for being here today. Because I wasn't very confident if I would be able to give you the required information, because I've only been in this for 1 year.
And for all, you should never think about like you are DNB radiologist and you are MD radiologist. You just think you are becoming a radiologist, and you have to work like that only. And you should not pressurize about it. And thank you so much, Riya, Dr. Riya.
Yeah, thank you so
for
much
inviting us and
getting us to your channel.
So thank you so much, guys, and I'll see you again soon. Bye.
Okay, bye.
और रिकॉर्डिंग शुरू हो गई. बट टॉपिक क्या था हमारा आज का? हाँ, डॉक्टर मयंक
वरुण बोला.
नहीं आपको
डॉक्टर वरुण बोलेंगे, ठीक है? होला बोला नहीं बोलेंगे.
ऑब्वियसली. हल्ला.
बी रिलैक्स्ड. कोक रख देता हूँ यहाँ पे सेंटर में.
है आपके पास?
है ना, निकाल.
लाइक कोल्ड ड्रिंक वाली कोक ना.